unfortunately. Because majority of the JR, once they finish, they might probably work as a staff for some time, but then you just jump onto specialties and then gleefully forget general surgery. I mean, this is the natural process that takes place. By and large, surgeons are jolly good fellows. The first time I came here to address this sort of gathering, one boy was telling, I don't know whether he's around here, surgery department, ഏറ്റവും jolly department ആണ്. ഇടയ്ക്കിടയ്ക്ക് ചായ കിട്ടും, വലിയ പണിയൊന്നുമില്ല, അതുകൊണ്ട് ഞാൻ സർജറി എടുത്തു പോകുന്നു. I don't know if anyone of you are here. I can't recognize your face right now. Who spoke about that? There was one guy who was telling that he used to skin buffaloes and all. Oh, you're there. Okay. My memory is not that bad. It's very interesting that many of you, perhaps none of the postgraduate students who have joined as the first year JR have got the medical background in the sense that none of your parents, that's what I understand, the siblings maybe, but are doctors, majority of them are engineers. I'm very happy to hear that someone's brother is serving the Indian Navy. Very good. So that's one thing. The majority of them are either influenced by their parents. And I would say that if you want to take up surgery, but for that matter, anything, it should be by an act of design rather than accident. As most of you are coming to the government college, I'm sure you must be having good ranks. But down the line, in the NEET, when the rank goes over 10,000, etc., 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 and they're forced to take something because you probably would have attempted 3 or 4 times and you would have said quits now and okay, the hell with it, I'll join surgery. Surgery is not a specialty that you just should take by accident. Because to become a surgeon, or a surgeon himself is an artist. If you have got science and art mingle in medicine department or in our curriculum, I believe it is surgery. One of my professors used to say that singers, artists and surgeons are born, they are never created. So you must have that aptitude. Just because, yes, many of you are influenced. Sreejayan showed his heart to somebody. Not his heart, I'm sorry, the patient's heart, and you were infatuated to surgery. That's good. No, you will have somebody, some mentor, or someone you might be following. Well, if you ask me, I just wanted to become a surgeon and nothing else. I wanted to become a teacher and nothing else. And I succeeded in that. And that's when you say that you are probably mostly satisfied. The job satisfaction that you get out of that is tremendous. When I retired also, I said only these 3 things. I wanted to be a doctor, I became a doctor. I wanted to be a surgeon, I became a surgeon. I wanted to be a teacher, I became a teacher. And I'm retired. So gleefully, I'm very happy. So that way, if you pick up a faculty, you must have that satisfaction and go through the rituals of it. Surgery is a long sojourn. Don't think that 3 years of training here will take you all over and you become a consultant. And unfortunately, in India, that is a system that we follow. If you go abroad and work, particularly if you are in the United States and all, you will find that your rigorous residency program, unless you succeed in your rigorous residency program, you are not probably a certified doctor. And surgery, you have got 5 years of residency program in US. And to get into a surgery residency program itself is difficult after your SMLE. So that's the situation. But then that 5 years of grilling will really take you through to become a certified doctor, and then you are a free bird. And the United States, well, life is totally different, unlike UK or other places. I don't know, majority of you would like to move out of India after your post-graduation. Few may be lucky enough. Many may not be lucky because the chances abroad are probably becoming bleaker and bleaker. You are lucky in one sense that you are into Calicut Medical College. I have treaded the roads, the hostels, the wards, the corridors, the casualty of this medical college from 1967 onwards. It's a wonderful college to be in, either as a student or as a teacher. I don't know the present state of affairs, the relationship between the students and the teacher. It was fantastic during our time. I'm sure it must be the same because most of you love your teachers. It is reciprocated also. Because the surgery department here, you find the collection of cases that you find in Calicut Medical College. I can with reasonable authority say that you will never ever find even in the best of colleges in India. I had a student who came from Wales to do elective in my unit. She came for 3 months to do elective, in surgery alone. And within 1 month, she was telling, sitting in the casualty or the OPD, she was telling it is equal to reading each page of Bayesian law. That's the experience that they get. So make good use of that. Good use of the faculty that you have got. Good use of the materials that you have got. As I said, learning surgery is a long run process where you have to acquire knowledge. There is no shortcut to knowledge other than reading textbooks. Your theoretical knowledge is best assessed by reading textbooks only. But that alone will not suffice. Day-to-day ward work, being with the patients, spending time with the patient, spending time with your colleagues, spending time with your seniors, your teachers, it's very important. I believe 24 hours a day is not just adequate for all these things. But unfortunately, the clock is set only for 24 hours. That's the situation of learning surgery. So experience comes by and by, no doubt about it. All of us were raw, bullish to start with. Do anything that comes into the surgical ward, you are acting like a bull, do surgery. That is the starting stage of every surgery. But then you mature, you mellow down over a time, find out that you have to be choosy in selecting patients. And I'm sure the best surgeon is the one who will always say when not to do surgery. You have wielded the knife. Doesn't mean that every patient coming to the surgical department need to be operated upon. A very nice, I wouldn't call it sonnet, but few lines, because surgeons beware of the knife, because beneath the knife wriggles something what is called life. So you have to be very careful when you wield the knife. That you will learn over only a time. And most important thing, all of you will become mature enough to be good surgeons. I wish that all of you do become good surgeons, which requires a lot of commitment. There was a textbook here written by Ionite. You may not know him, nor perhaps many of the guys sitting here would have read Ionite. A textbook made by surgery written by a professor of surgery at Hammersmith Hospital when he was 36 years old. He was just 36 years when he was the head of the department of surgery at Hammersmith Hospital. Committed suicide. But his textbook, if you ever happen to see the first edition of Calicut, you will find that the knowledge that he exudes in his book, it was bigger than Bayesian love, you can call it. A second edition has come, but it is not as good as that. Because if you want to describe gastric ulcers, he has described 25 varieties of gastric ulcers in his textbook. In the making of surgeon, he has very, very vehemently said, either the knife or the wife. One guy is married, one girl has got a child as well. It's a commitment. Right? I'm not telling that you should not get married. So, that's what Calicut said, either the wife or the knife, not both. In the making of a surgeon. Because he has written a textbook on the making of a surgeon. He has written the system that is followed in United States, in India, and England, everywhere. He was an unfortunate person. He never married, and he used to stay in the houseman's quarters. For some strange reason, he committed suicide, keeping the Bible in his hand. This is what the late Professor Dr. Sreejayan.M.P, sir, he was his assistant at that time in Hammersmith Hospital. Now, as you start doing surgery, I would always say that you understand what you're doing. You should be really prepared to assist, learn from seniors. The process goes this way. You can learn even from, most of you learn perhaps by seeing YouTube perhaps these days. But stay close quarters to a senior surgeon. So observe great people do surgery, assist them, then be assisted by them, and the last stage will come, be observed by them, so that you are on your own and they observe you, and once they observe you and are satisfied, they will leave you alone. They will leave you alone. That is the way the process should take place. Not on day one that you will have to go for a hemicolectomy, do a hemicolectomy. You will do, by and large, no doubt about it. Most of the guys sitting here on the front, Gopi, everybody has gone through this phase. It's very important. And in that process of dealing with patients, please extend as much of compassion and empathy. So another man's pain, if you can appreciate, that is a great event. If you can empathize with the patient, then you are a complete doctor. If you cannot empathize, whatever your degree is, whatever your faculty is, whatever your knowledge is, you are no good as a doctor. And the last thing is humility. No matter what you achieve, you should be humble enough. The humility will come only over a time. Because initially, as I said, you would be brash. You would like to oppose arguments, or you start off arguments. I'm not saying that constructive arguments should be done, in spite of the fact that whether a person is senior or junior. If you think that you are right, based on scientific data, you should definitely go in for arguments. And even that argument, it can be extended to examination also, provided it is done in a systematic way. Right? That is where the humility comes. That is the most successful thing. Right? Of all these people, I would like to ask you, how many of you enjoyed anatomy? 19, raise your hands. 18, I'm sorry, one guy has. First years, guy, third years. You have to enjoy anatomy now, you can't help it. Because anatomy is a subject which most of the students, good, you did from Bhopal, AIMS, isn't it? Yes. Anatomy is a subject which is hated by the first years, particularly in the compressed program of today. I think most of us spent 2 years dissecting the body. Enjoying it perhaps? Not many. I'm sure not many enjoyed anatomy even at that point of time. But if you master anatomy, if you master pathology, learning surgery is very simple. I think these are the 3 important things, or 2 important things as a corollary to surgery. What else shall I say? I think I don't have too much of advices. Yes, you have got a lot of experience that is probably being written down over days and all. It's not to be published as a book or anything, but then I just collect all my cases. It is always a good idea that every case that you see, you make a note of it. Every discussion that you do, you make a note of it, because you probably get some points, either you Google or you go to the Netscape. So utilize the library very well, because you have got tremendous access these days, not like us when we had to be totally dependent on textbooks and all those words that come from the mouth of our gurus. So you are not able to challenge them sometimes. So later when you started challenging them, that is the problem arises. Right. So with this short sort of, I wouldn't say advice or sermons, just take it from an old man, that surgery is a lovable art, provided you start really enjoying it. As most of you said that you like surgery because you were infatuated either by your teacher who does surgery or during house urgency or otherwise. So most of you, perhaps all of you, have said that you have come here by design and not accident. So let me take this opportunity to wish you the very best. Let me see you as very good surgeons, useful to the society. Thank you very much.